Today's topic is the protocaval anastomosis. So, this anastomosis is usually taking place between the veins. So, first, it is also called as the portosystemic anastomosis because the veins involved in this anastomosis are the portal vein and the systemic vein. Portosystemic, portal vein and the systemic vein. So, these two veins get connected to form this protocaval anastomosis. So coming to the sites of the is anastomosis, where all these anastomosis is taking place in our body. So first is the esophageal anastomosis. This anastomosis is taking place between, as I said already, between the portal and the systemic vein. So the portal vein in the esophageal anastomosis is the left gastric vein, whereas systemic vein is the azygous vein. Okay, so these two veins get anastomosis at the esophagus end. Okay, so this anastomosis is taking place at the end of the esophagus, which is referred as esophageal anastomosis, which taking place between the left gastric vein and the azygous vein. Okay, so second is the rectal anastomosis, which is taking place in the rectum. So portal vein is the superior rectal vein, whereas systemic vein is the middle and inferior rectal vein. So the superior rectal vein get anastomosis with the middle and the inferior rectal vein. So this is referred as the rectal anastomosis, which is taking place in the rectum. So coming to the para-umbilical anastomosis, around the umbilical region, this anastomosis is taking place between the para-umbilical vein and the vein which is presented in the anterior abdominal wall. Okay, so these gets anastomosis, which is referred as the para-umbilical anastomosis. So coming to the retroperitoneal anastomosis, retroperitoneal in the sense which does not present in the peritoneum. Okay, peritoneal cavity. So this anastomosis is taking place between the pancreas, spleen, colon veins to the retroperitoneal veins. Okay, this anastomosis is taking place in the retroperitoneum cavity. So here you can summarize all those things. So first is the esophageal anastomosis, which is taking place between the left gastric vein and the azygous vein. So this is the site of the esophageal anastomosis. Coming to the para-umbilical anastomosis, which is the site here. So this anastomosis is taking place between the anterior abdominal wall veins to the para-umbilical veins. Okay, and the rectal anastomosis between the superior rectal vein to the middle and inferior rectal vein. So again, another we saw is the peritoneal anastomosis, retroperitoneal anastomosis, but which we can't depict in this picture. So again, one more important thing is the anastomosis at the bare area of the liver. Okay, this anastomosis is taking place between the phrenic veins, okay, and the hepatic veins. So these also are the anastomotic site. So coming to the clinical significance, we have portal hypertension. This hypertension is usually occurred during the liver cirrhosis. As we know already, what is cirrhosis? The liver tissue becomes damaged and it does not function. The liver will not function properly. So which leads to the increase in blood flow through the anastomosis in the portocaval anastomosis, which leads to the portal hypertension. So these are all about the protocaval anastomosis. Thank you.